Welcome to the Holistic Therapy Interviews. And today I'm joined by Rebecca Dove Thomas. Hi, Rebecca.
Hi, Lucy. Glad to be
And
here.
we're going to be diving into the world of homeopathy. So, first of all, I would love to just introduce you to Rebecca. She started studying homeopathy over 20 years ago at the age of 26 because she had had some personal health challenges and she knew she had a calling to help and care for others. So, she went on to do a course in Wales over 6 years. And at the same time, she was being healed with homeopathy. And so, with that, Rebecca, I would love for you to share your own story, your pivot moments, and exactly what homeopathy has meant to you.
Great. My journey with homeopathy started when I was at uni and I got diagnosed with endometriosis. And I didn't at that point know anything about homeopathy. I went down the conventional road and I ended up having some quite intense hormonal treatment. And I was basically told you're going to have this problem the rest of your life. You're not going to be able to have children after a certain age. And we know that endometriosis can be very, very debilitating. I was fairly lucky. It was a fairly mild, but it would have got worse had time gone on and left unchecked, really. So went through this reversible early menopause at 21 while I was doing my university finals. That was fun, but did try to sort of use things like aromatherapy and some herbs and things like that and some techniques. So I was already very open to learning more about natural health and healing, but I had no clue that that was where I was going to be headed. And it wasn't until a friend of mine was getting better from ME and I asked her what she was doing. And she started to tell me about homeopathy. I go and see this woman and we have a chat for an hour and then she gives me a pill and I'm like, oh, okay. And then after a bit, I start to feel better. So I was very curious. I had actually applied to go and do my nurse training a couple of times. Every time it happened, something would get in the way. Something would be out of my control. Something would change. I'd get offered a job. I'd have to go somewhere. It just didn't happen. So when I discovered homeopathy, I actually went to a big mind, body, spirit fair in Builth, Wales, and the Welsh School of Homeopathy was actually there. And I was chatting to the lady, and she was a student. She just graduated, so she just begun her homeopathic career. And I was immediately, this is so interesting. I'd been looking at books of my friends, and I went and did an introductory course, which was brilliant because it just gave the basic principles and some first aid home prescribing, because that's a wonderful thing about homeopathy. You don't have to be a practitioner to help and support your family in a day-to-day kind of way. We always say if something's been around for more than 3 weeks, you need to go and see somebody. But if it's, for example, a cut finger or a bump of the head, or as long as obviously they don't need to be hospitalized for any reason, there are lots of remedies that we can use in our homes and get started with straight away. So I'd obviously did this course, drank in every moment of the words. I couldn't believe the things I was being told about how the body heals and how in homeopathy it's all about expressing what is happening rather than perhaps suppressing, which is what some of our drugs and treatments tend to do in the allopathic conventional medicine, as it tends to squash that down. This is more about finding something in nature that resonates with that state in you and giving it to you in a safe and measured way that then matches those symptoms but actually helps the body to work out what's wrong. And so that it's very gentle. It's like it recognizes how individual and how different everybody is within it. So, for example, when somebody comes to see me, one person will talk about stress, another person will talk about stress. That stress will be totally different for those people. So we've got to find what's at the core of that. And the same even with a cough or a cold. Is the person just want to lie in a darkened room and not talk to anybody? Or is the child running around like there's nothing wrong with them and then flopping? So all of these things give us information about the kind of remedies they might need. So I learned this and then immediately signed myself up for the course that September and went for an interview. And I think this was like, there was a light bulb moment that went on. I was on a bit of a track. I wasn't really thinking much. I was just like, this feels right. This feels right. Went for the interview. We were sitting outside where the Welsh School of Homeopathy was, and a little dog and two cats suddenly ran up beside us where we were sitting, and there was a whirlwind going past. And I could see the course director looking at this, looking at me and thinking, oh, okay, maybe there's something here. And as I've gone on to learn, it's all about energy and it's all about recognizing energy. And I think that was my sign that I was meant to go for it, really. So started the course, and literally it was like my life got turned upside down. Obviously, I started having homeopathy for the endometriosis symptoms, and just generally because I was curious about what could it do for me. I was aware that there were maybe some things that weren't quite right in myself, but nothing that I could put a finger on myself. The process and the journey with the homeopath allowed me to bring things out that I'd had to put away because they were too painful to deal with. But over the months that we worked together, I started to be able to talk about things in a way that I never had before. I could go deeper and deeper and deeper, sometimes revisiting something over and over again until you really get to the core of what it is that needed to be dealt with. And that carried on, and also the course pushed us in that direction too. It was very much about self-process and understanding, because let's face it, you cannot work with someone else if you have not done the work. No. You cannot go into traumas or grief or the life of living with chronic illness unless you have walked in your own shadows, dealt with your own stuff, and opened yourself up to the fact that actually, as human beings, we're a very complex little tangle of stuff, lots of shocks and experiences, and we need to unwind that to find out who we really are. And I think for me, that's what it's done. Homeopathy has shown me my way, who I am at my core. You can take a remedy and it can sort out your finger, but another remedy might actually dissolve your limiting beliefs. I've seen transformations happen in people. So once I graduated, I went and worked in a homeless project. Locally, it just opened, and the guy there was very open to me coming and running a clinic every fortnight. And I started to work with one woman in particular. And this is the point at which I all doubt about whether these diluted little pills actually worked kind of changed, because she was a lady who had an 11-year crack cocaine and heroin addiction. And she came to me once, and then she came back the next week, and I gave her a different remedy. And then she came back 2 weeks after that, and she shouted at me and said, what have you done to me? Because after the 11 years, she had no cravings. And I was a bit like, what? How on earth could that be the case? My little sugar pill that I've given you with this remedy in it has transformed your relationship with an addictive drug. At that point, I went, okay, I know nothing. I am absolutely in awe of the power of this medicine, and I want to work with it more and more. So for me, it was actually being out there and seeing the massive transformation that it could make. Of course, I'd seen slower and different things kind of happen in my training, but that was a real turning point for homeopathy.
Yeah, I can imagine. I mean, that was so fast, Rebecca, as well, wasn't it?
Unbelievable. And what I have to say is that I did work with her for 5 months afterwards alongside the drug rehabilitation team, and she was dry for that time. She was having regular tests, so they knew whether she was telling porcupines about whether she was doing it or not. And having worked in kind of homelessness a lot, I've seen it all before, but this was remarkable and it was incredible. She turned her life around. And I've seen that in my own practice and in my own life. What no longer serves you seems to disappear. New opportunities come in. You think, how does that happen? But we know when we do the work on ourselves, you start to resonate with things on a different level and life starts to change. And once you've cleared that kind of old pattern, you start to go into a new pattern and something that's much more positive for you. And that influences your health, of course, as well. And in my case, endometriosis wise, I basically haven't had an endometriosis symptom in over 20 years now. I'm 48. And I think basically all my whole fine, managed to clear out all the effects both of the endometriosis and of the medications that I had for it, because that kind of hormonal disruption that happened needed to be cleared out. It left me with massive mood swings and oh my goodness, I sort of anything hormonal, I couldn't be on the pill or anything like that afterwards. So the homeopathy helped to detox me as well of that. And then I didn't think about having children for a while, but then eventually I ended up having my little boy when I was 43. I didn't have any sort of interventions. I gave birth naturally by a little bit of gas and air, and I used homeopathy in the birth as well. It wasn't just kind of looking after me as a whole. It was to work on things. I had a little wobble at one point where the placenta wasn't coming away. I took a little pill out of my birthing kit that I've got here, and within 10 seconds that placenta had gone, and I could see all the doctors going, what just happened?
Yeah, what did you take?
We were going to prep you. There's actually a remedy made from which my homeopath made that remedy a number of years ago, and they're a part of a beautiful set of remedies which are called matronals, or the gifts from the mother. And the idea that on some level, if you're looking into ancestral healing, we need these remedies, but they also can come up if there's any sort of shock or trauma in utero when mum is pregnant, in the child, or in us later on. So yeah, pretty magical, really.
Absolutely. Little
What are we
birthing
doing?
toolkit.
It is, and that's the thing, is the universe is the homeopath's toolkit. We basically use remedies from practically anything.
So yeah, so I'm gonna ask you. So that's wonderful hearing your story and about the endometriosis, and anybody listening in that has challenges in that direction, it's certainly worth looking into homeopathy. And so what are the remedies made of? Are they loads and loads of different things? How does that work, Rebecca?
Right. Well, originally there were probably about 80 to 100 remedies made originally, and they were generally from things that people were using medicinally quite often. A lot of them are plants and herbs that we're fully aware of. Nowadays, there's over 8,000 remedies. So the span of what is available is much, much bigger. The majority of remedies certainly are plant-based, but we also use remedies from the mineral world. So one of the best remedies, I think, for the kind of character of the United Kingdom in terms of you stip up a lip and carry on and just keep going, is Nature Muriaticum, which is the remedy made from common salt. In that, you've got, it's obviously a salt, it's a mineral. The picture of it is always very interesting because it's kind of like the tendency is to close the heart down. And because feeling things or going through sort of the grief process is difficult for that person, because they're actually quite sensitive, but it's easier just to lock it away and keep it under wraps. In that, so you can give somebody Natmure if they've had a grief, particularly where they've had to carry on, they're responsible for the family, they've got to deal with things, they can't just fall apart at that moment. And often then it will allow the grieving process to happen very gently, and they get to a point where they feel much stronger in themselves and a lot less vulnerable, and then they become stronger and healthier in themselves overall. So plant remedies, mineral remedies, and we have a lot of remedies now from the animal world. So some of those are things like the sting of an insect. So the majority of them are from the mammal world. So you can have remedies that are made from the milks of animals, which is quite interesting. It's a little bit more esoteric in some respects, because it's not quite like, oh, you've got a spirit animal and therefore you need their milk or anything like that. It's that certain in modern life, we have a lot of stress, and the animal world is more an area where stress and conflict are more recognizable, if you like. So, territorial and pecking orders and stuff like that. So when somebody's talking about their life in those terms, and often kind of very much looking at the other people in their lives in terms of dynamics, they often need an animal remedy. Whereas if they feel there's something not quite right with them, it's quite often they need a mineral remedy. And the plant remedies are very sensitive and tend to be more kind of in the moment and affected by what's going on around them in a different way as a plant would be. So you can see this kind of relationship between the way we are and the remedies. Hopefully you're not going too much off on a tangent, but there's a lot to it, if that makes sense.
Yeah, no, exactly. And so if somebody were to come to see a homeopath, and maybe homeopaths work in different ways, and there's kind of a spectrum of the way that they work, but what would they expect to experience when they first came to see a homeopath? Because it's more than just going, here's a remedy, that's going to sort you out, off you go, because you've already explained that. So you guys go a little bit deeper for our audience.
So if somebody, say, comes to see me and they've got an ingrown toenail, then even though they've come to me for the ingrown toenail, I want to know about them as a person. What makes them tick? What are their likes and dislikes? What's their digestion like? What's their medical history? What else have they got going on that is part of that whole? Because although obviously they want their ingrown toenail sorted out, there's going to be other things in them that is either a reflection of that or perhaps is indicative of perhaps when the thing started. We often like to know, when did it start? What was going on in your life around that time or just before? Is there anything significant, any traumatic events, anything like that? So we start with what's going on and then we have a conversation. And then as things naturally appear, we allow them then to come up and out. And if somebody doesn't feel comfortable talking about something, they might not talk about it for the first couple of times they come to see me. But by the third time, and hopefully if we've managed to sort of improve things more generally, they will actually come out with some of the deeper stuff that is perhaps holding them back, or is the seed of why those physical symptoms have started, because the body is a reflection of the mental emotional 100%.
Yeah, everything affects everything else. It's that holistic
Exactly.
approach, isn't it?
And we might also talk about your family health, because these days we know there's genetics, but inherited tendencies towards things are very important. Things that happened during a mother's pregnancy. So I treat a lot of children, and that's the other side of it. So if you're bringing a child or young person to me, then I am really interested in learning about that child as much as possible. So sometimes some of it I will actually do outside of the session with the parent. I'll get them to tell me about some of the more difficult side things potentially. I treat babies upwards. So I have a lot of children in my clinic that are neurodivergent and quite often are not speaking as well. So I provide lots of playthings for them while they're in the room. It's really interesting to see what attracts them, what they're interested in. Do they want to draw something? Can they express themselves in different ways? If they can talk to me and they want to talk to me, and some children definitely do, I can't stop them, then that gives me lots of information too. And I love to hear about dreams, both adult and children, because often the dreams will give you clues to things that you wouldn't normally get from somebody telling their day-to-day story. So if somebody dreams of giants chasing them, that gives me an idea of a remedy. And there is a remedy that is very interesting. It's made from the little club moss. It's called Lycopodium. But in prehistoric times, this moss was a giant tree. It was huge. And over time in evolution, it has actually become tiny. And in the Lycopodium patient, they often puff themselves up. So there'll be the child that will tell me, I'm the best, I do this, I do that. But you ask mum what they were like before they arrived, they were terrified. So there is this feeling of being very small, but they want to be big. They want to be seen. They want to be noticed. So you can see kind of an insecurity. I mean, they are the child who before their exams or their driving test is hell to live with. You know, they won't let you in the room. They're shouting at you for everything. They're very domineering. And domineering is a big part of but you know, it's a brilliant remedy for so many things. So if somebody comes to me with a child with eczema, for example, but that child is bordering around the room, then I know that really what that eczema needs is the lycopodium, because that's the mental emotional state, and that's where you find things out.
Wow.
And yeah, it's just a very interesting. People are fascinating.
I was going to say that was the word that came to my mind. It's like, it's absolutely fascinating because it's not just the remedy, it really is the whole person and their personality and what they're going through inside.
Definitely. And I think if you look at homeopathy and you want to find a homeopath for yourself, it's worth having a think about the kind of homeopath you want to go to. Because some homeopaths, they will be very meticulous and very much go sort of from a cerebral point of view. So these are your symptoms, right? We'll work through that. Da, 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 da. And others will be very, very intuitive, and they almost seem to channel in the remedy. I'm probably somewhere in between. I do the groundwork and I make sure that I understand the remedies and what is being presented to me. But I also find there's a little sort of flash or a glimmer of something that will come in that you're not expecting. A little child in my office the other day who, non-verbal again, 4-year-old, and he kept going for the elephants and he kept trying to get the elephants. And anyway, so we carried on with the case, lots and lots of other things. But when I looked at the elephant remedy picture, the milk of the elephant, a lot of what this child was coming to me with was actually in there. And when I saw the behaviors, I just thought, I got to give it. So, although there's other things that I would give around that, I also feel that that child is calling for something. And that's the bit that I love. It's a bit of magic that comes in. A plant can come out of nowhere. You just think, why have I opened the page on this? And you think, oh my goodness, that's the remedy this person needs. But I never would have got to it in the normal way because, the mental working it out way takes a long time. So,
yeah, that intuitive insight, the universe, however you like to look at it, however you feel about that. Oh, I love that.
Exactly. I mean, there's all these books, there's so many remedies in there. I can't possibly know every single one in detail.
No.
So it has to be that sometimes you get a little help from somewhere too, I think.
A little nudge. So you can really help a really wide scope of ages. You're saying from birth, presumably right up until like the toenail, to endometriosis, to stress, to drug related. So it's huge.
It is. I mean, that's the thing, is that there's a remedy for everything. And there's an old saying, God didn't make an ailment that there wasn't a remedy for. So I very much live by that one, that there's something out there for everybody, and no matter what it is. That's the interesting thing about it, is that you don't know what you're going to come across next. I treat a lot of people with neurological issues as well. So tremors and shakes. And that you can't get clearer evidence of homeopathy working than somebody no longer shaking or having twitches and jerks. So
is that like Parkinson's and those sorts of
Parkinson's? I get quite a lot of people that don't have a diagnosis, but they have a lot of shakes and tremors. So they're not getting the Parkinson's diagnosis, but they are shakers, if you like. The tremors are there, but it isn't necessarily going to be that chronic. But yes, Parkinson's, I mean, quite often people come to homeopathy because they've tried everything else, and quite often it's end of the line and nothing's worked for me. Can you do anything? And that's when it's interesting, because it does, and they've tried everything else. So
with something, just going back to the Parkinson's, with something like Parkinson's, is that something you've seen big changes with somebody in, or is it
you can really, I mean, you never say that you're going to cure this or cure that. It's about helping someone to manage, and some of that is the mental emotional layer, as well as being able to cope and not feel overwhelmed with chronic illness. But in terms of managing symptoms and helping that person to live more freely, then definitely I've seen that over and over.
Wow, fantastic. Well, Rebecca, I could talk to you for another hour, I think. This has been fascinating, it really has. We're going to come to our last question. So that I'm going to ask you for your top 3 tips. But just for our listeners, for our audience, a very quick overview. And so we've dived quite deep into what it is, what the remedies come from. There are over 8,000 of them.
Yeah, good, if not more now.
Yes. And so, but you're looking at, the homeopathy is looking at the whole person, what's going on inside, as well as the thing that you think, oh, I need to get that sorted. And so expect to have, it's almost like counseling, but it's not counseling, but sharing as much as you can to help your practitioner to work out what's the best remedy for you. And then coming back over here, if somebody feels like, well, what can I do? What are my first 3 steps, Rebecca? Because I know you said there you can start by just doing home remedies. Maybe that's one of your steps.
Absolutely. There are 3 things that I would definitely suggest to start with. First of all, is to get yourself some sort of a kit. Now, that's a birthing one. The blue one is the one I normally suggest for people. You can see the remedies. Just see how there's. Oh, that one's been used quite a lot. My son gets a phosphorus cough quite often, which is a dry cough, but the child, it doesn't look ill. That's very much the kind of picture of phosphorus. But you can see there's a little pilule in there. That's the pilule, the remedy. The kits are roughly about 30 to 50 pounds, depending where you get them from and how many remedies are in them. But this is a way then you've basically got all the first aid and basic acute remedies. So, if you, in our kitchen, I always have hypericum, which is the remedy made from St. John's wort, which in homeopathy we don't tend to use for depression so much. We use it for its ability to heal the nervous system, and particularly if you have a cut or a, I'm forever cutting myself on pieces of glass or something else, and it can be pouring, and I'll take a hypericum and it literally stops in seconds. And it helps with the pain, because obviously anything nerve related, if you cut yourself and you cut through a nerve, it's painful, isn't it? Hypericum is known as a very good painkiller in that way, particularly for that. So that one is always in the kitchen. And arnica is the other one, which most people have heard of, but they mostly know it as a cream or perhaps as a herbal. But the homeopathic obviously works deeper on the deeper level inside. But any sort of physical shock, anything where bumps and bruises, little children bump their heads, obviously check that they're not concussed. But if they get an egg, this is quite a good one. Give an arnica, you often see that egg go down. It just takes all of the shock out of the system. And then what I would suggest is to get yourself a good homeopathy book that you can have at home. Miranda Castro's Homeopathic Guide is my favourite. In this, it sort of gives you a way of finding out how to work out the remedy, because you have to match it to the emotional state, but also what does the person want to do to make it feel better, and what makes it worse. Very important in homeopathy. We need to know the details of that particular symptom. It's not enough to say, oh, it hurts. If you've got a headache, you need to say, oh, it feels like it's splitting, or it's pounding, or it's on the top of my head, and it comes on with the cold weather or something like that. All those little details will help you find the remedy much clearer. And then find yourself a home.
Where's the best place to do that? Is there a register of homeopaths, Rebecca?
There's various bodies that register professional homeopaths, and you'll find them on findahomeopath.org. Is the easiest way. And I would say definitely either meet or arrange some sort of a chat with your homeopath before you start, because finding the right person for you is vital, either because of their expertise or because of their way of being, depending on what you want to work with. Do you gel, or is it going to be an awkward relationship? Do you feel like they've got you? It's like any other therapy. You've got to feel right with that person. And they've also got to feel that they can help you. In my practice, I always have a curiosity chat with people before they come in. It doesn't matter. Every time I don't, it always ends up being not right. So I've learned from experience, not that anything terrible happens. It's that gelling. It's making sure that it works for both of us.
Yeah, it's a two-way relationship, right? Yeah,
definitely. I very much see myself as a family homeopath. So if somebody comes to see me when they're a baby, I'm still going to be around in 20 years when they're perhaps dealing with some of the other challenges in life. So I want to be a bit more like that sort of almost family, that family physician that is there to support people through their lives and longer term. And hopefully I've got a good few years left in me with homeopathy and a bit of other well-being stuff. It should be around to see it.
Sure.
Yeah.
I'm sure. Well, thank you so much. I think we got an extra tip in there, which I always love when we get an extra one. And if you are lucky enough, you're Shropshire based, aren't you, Rebecca?
I am.
So if you're lucky enough to live in Shropshire, then you can see and find out more about Rebecca. I'll put details in the description, so do drop down there. There'll be another interview coming up online. So if you want to find out about more holistic therapies, do click away on that, and I will see you over there. Thank you so much for joining us, Rebecca. It's been amazing.
Oh, it's been great. Thank you so much, Lucy.
Thank you.
Bye-bye.